Assalamu alaikum, dear friends. Today we are going to discuss abnormal uterine bleeding. Any abnormal bleeding from the uterine corpus that is abnormal in volume, regularity or timing, and that is present for the majority of last 6 months or more is known as abnormal uterine bleeding. This is the definition of the abnormal uterine bleeding, and this has replaced the old term which was known as dysfunctional uterine bleeding. There are different types of the abnormal uterine bleeding that are prolonged bleeding, intermenstrual bleeding, postcoital bleeding, heavy menstrual bleeding, or any cycle irregularities. To understand these abnormal types of the bleeding, we must need to know what are the normal parameters of the menstrual cycle. Menstrual cycle is described in terms of frequency, duration, regularity, and flow volume. Normal frequency of menstrual cycle. It is between 24 and 38 days. If the cycle comes after 24 days and less than 38 days, this is known as normal menstrual cycle. But if they are coming in less than 24 days, this is known as frequent menstrual cycle. If the bleeding comes after 38 days, this is known as infrequent menstrual cycle. What is the normal duration of the bleeding? Normal duration is less than 8 days. If bleeding occurs for more than 8 days, this is known as prolonged bleeding or prolonged cycle. Regularity is defined either they are regular or they are irregular. And how this is determined? The periods are regular or irregular. They are determined by calculating the duration between the longest and shortest cycle. If the duration is less than 7 to 9 days between the longest and shortest cycle, this is known as normal cycle or normal bleeding regular menstrual cycle. But if the duration is more than 8 to 10 days, this is known as irregular menstrual cycle. And the flow volume, this is a subjective term which is described by the patient. Either the bleeding is normal, bleeding is heavy, or there is slight spotting or very light bleeding of the menstrual cycle. Abnormal uterine bleeding is described in terms of its frequency, duration, regularity, volume, intermenstrual bleeding, and unscheduled bleeding. So before going forwards, we need to understand what is acute abnormal uterine bleeding and what is chronic abnormal uterine bleeding. Acute abnormal uterine bleeding, it is defined as episodes of heavy bleeding that is, in the opinion of clinician, is sufficient quantity to require immediate treatment to prevent further blood loss. This is acute abnormal uterine bleeding. And chronic abnormal uterine bleeding has been defined as any bleeding which is abnormal in its volume, regularity or timing that lasts for more than 6 months. That is chronic abnormal uterine bleeding. And there are two terms which need to be understood: what is heavy menstrual bleeding and what is intermenstrual bleeding. So any excessive menstrual blood loss which interferes with the woman's physical, social, emotional or material quality of life, this is known as heavy menstrual bleeding. Heavy menstrual bleeding has replaced the old term menorrhagia, and that described more than 80 ml of the blood loss. The new FIGO definition of the heavy menstrual bleeding is excessive blood loss which interferes with women's daily life. Intermenstrual bleeding is defined as a spontaneous bleeding which occurs between the menstrual cycles. This can be cyclic or random bleeding. This is known as abnormal uterine bleeding. And in our next video, we will learn what are the causes of abnormal uterine bleeding and how history is taken about the heavy abnormal uterine bleeding. Thank you.